Invisalign is a great option over braces because I get to digitally plan where your teeth are going to go. So I can stage movements, meaning if I want a certain tooth to move at a certain time, I'm able to do that with Invisalign because the plastic is going where I take it. With braces, we tend to have everything moving at once because you have the wire, and the wire of the braces actually moves the teeth. But with Invisalign, I'm able to program which plastic is moving your tooth at which time. So if I need a controlled movement, meaning it's a specific and trickier case, I always like to push Invisalign because I have full control of where I'm actually moving a tooth as long as the patient's wearing it. With Invisalign, there's no discomfort. The plastic is actually cut around your teeth, so that way there's no feeling on your gums, because back in the day, the aligners used to be on top of your gums. So a lot of people had the feeling of having discomfort. Nowadays, with Invisalign's new protocols, they're actually cutting the aligners around the gums, so that way there's no discomfort. Invisalign treatment usually takes around 18 to 24 months, but a lot of people that choose aligners sometimes need, more mild treatment. So I always like to say it all depends on case, meaning if you're someone who just has a few teeth that needs to be straightened out, Invisalign can finish you within 8 to 12 months. But if you're someone who has a lot of crowding, a lot of crooked teeth, Invisalign sometimes takes 1.5 to 2 years. A lot of people do not wear the retainers, so a lot of teeth shift back to their normal position. Typically, it's the bottom teeth that move the fastest. So I get a lot of people who are 25 to 30 years old who had braces in the past and only want a few teeth fixed on the bottom. I always say that's a great candidate for Invisalign because I can tailor to their needs, meaning I don't have to make the top Invisalign. I can just focus on what their needs are. So if they want a few teeth on the bottom shifted, I can make a few trays to shift their bottom teeth to where they should be. And that really is, makes the patients happy because they don't have to go through the full braces. They don't have to go for a full 1.5 years. They get something limited and get what they want out of it. Invisalign would not be appropriate for cases that are super complex and I need a lot of discipline, a lot of time with treatment, because with complicated cases, sometimes they go a little longer than 1.5 to 2 years. And I always like to tell the patients, this is something you have to commit to if we do the Invisalign. And a lot of people know they're not going to wear the Invisalign that long. With braces, they're kind of stuck with me, right? So the braces will make the treatment outcome perfect, even though the patient might be burned out or tired of wearing the Invisalign.